This is the gravity eliminated of the anterior deltoid, so the patient will be side lying on the non-test side. The arm is at the side with the shoulder in slight abduction and neutral rotation. The therapist supports the weight of the limb. The palpation will be the anterior aspect of the shoulder joint, just distal to the lateral 1/3 of the clavicle. So she'll have him bring him up into shoulder flexion. This is the gravity eliminated for the middle fibers of the deltoid and the supraspinatus, so the patient will be supine. The test arm is at the side and in neutral, and with the elbow extended. The palpation of the middle fibers of the deltoid can be felt just distal to the tip of the acromion, and the supraspinatus is unpalpable. So seen here, she's just bringing him into abduction. And that is gravity eliminated for the middle fibers of the deltoid and the supraspinatus. This is the gravity eliminated for the posterior fibers of the deltoid. The patient will be sitting. The shoulder is abducted to about 75 degrees. The upper extremity is supported by the therapist. The therapist will stabilize at the scapula, and the palpation occurs inferior to the lateral aspect of the spine of the scapula. So she's bringing him straight back, and that is the posterior delt. This is gravity eliminated for the subscapularis. So the patient will be sitting, the shoulder is slightly abducted in neutral rotation, and the elbow is flexed to 90 with the forearm in mid position. The therapist will stabilize the humerus to prevent shoulder abduction. This muscle is too deep to palpate, and as seen here, she's just bringing him into internal rotation. This is gravity eliminated for the infraspinatus and the teres minor. So the start position, the patient is sitting. The arm will be at the side with the shoulder adducted in neutral rotation, and the elbow is flexed to 90 and the forearm in mid position. The therapist will stabilize at the humerus. The teres minor is not palpable, and the infraspinatus is palpable over the body of the scapula, just inferior to the spine of the scapula. Both these are external rotators, so she will stabilize the scapula and then bring him into external rotation. This is gravity eliminated for the latissimus dorsi and teres major. The patient will be side lying on the non-test side. The arm will be at the side and the shoulder in internal rotation. The hips and knees are flexed, and the therapist supports the weight of the arm. The palpation of the latissimus dorsi is lateral to the inferior angle of the scapula, and the palpation of the teres major is the posterior wall of the axilla. This is the gravity eliminated for the pectoralis major. So the patient will be sitting, the shoulder is abducted to 90 degrees, the elbow is flexed to 90, and the arm is supported by the therapist. The palpation of the sternal head is the anterior border of the axilla, and the clavicular head is inferior to the middle of the anterior border of the clavicle. This is the gravity eliminated of the coracobrachialis, so the patient will be side lying on the non-test side. The shoulder is in slight abduction and external rotation, and the elbow is fully flexed with the forearm supinated. The palpation point will be just anterior to the brachial pulse, and the therapist will stabilize the scapula. The end position, the patient will flex and adduct the shoulder through full range of motion. And this concludes manual muscle test for the shoulder.